As a nurse, I am trained to trust medications. As someone living with MS, however, I had to learn the hard way that some of them can actually make things worse. There's been a time or two when my symptoms got suddenly heavier, kind of more fatigue, more brain fog. Things just felt off. My first thought was, is my MS progressing? But it wasn't. It was something I had taken without even thinking twice about it. And that moment changed how I look at medications forever because, well, no one had warned me. So today, I'm going to share what I wish someone had told me earlier, the medications that can quietly make MS worse, and how to protect yourself. Check it out. Now, I want to be really clear here. I am not anti-medication, not at all. As a nurse, I've seen how life-saving and how important they can be. But then having MS changes the equation. Because now you're dealing with a very sensitive nervous system, an overactive immune response, and that means your body doesn't always respond the textbook sort of way. And honestly, that's something I really didn't fully consider or maybe even understand for that matter until I experienced it myself. All right, so kind of a little story, if you will. In nursing, we're taught side effects. We're taught mechanisms. We're taught what should happen based on clinical evidence and literature. But living with MS, well, we get the privilege of experiencing what it actually feels like. I remember starting something that was considered routine. Nothing high risk or anything like that, nothing unusual. But within days, I felt a bit slower, a bit more fatigued, and that's not even getting into the side effects. While the symptoms sucked, I felt there was one more thing that was way worse, and that was the uncertainty. I'm thinking, is this me now? That was that question. It's something so many people, all of us with MS, carry. And sometimes it's not your disease changing. It can be your environment, your inputs, and your medications. Let's start with immune-stimulating products. Now, from a clinical perspective, these are often marketed as beneficial. Boost your immune system, fight off your illness. But here's the part that doesn't get emphasized enough. With MS, your immune system is already dysregulated. So stimulating it further, well, that can sometimes increase inflammation. If I saw these meds on a chart, I normally wouldn't question them at all. But living with MS or a patient that I see with MS, I might raise an eyebrow. So certain supplements like immune boosters, your echinacea, elderberry, ashwagandha, garlic, ginseng, that's just to name a few. Yes, and I know I mentioned ashwagandha to take in another video, but I was directing that in a stress-reducing manner. So despite this, make sure that you're checking with your doc to make sure and see what's okay. The other meds to be wary of are high-dose immune vitamins, like your vitamin C and zinc, with exception to vitamin D, because for whatever reason, that literature out there, vitamin D is actually a great thing for MS and helping to keep that inflammation low. To put this in perspective, I want you to think of it this way. Your immune system, unlike normal people, is the bad guy because it's attacking you. When you take things with intention to prevent colds and flu, you're giving the bad guy an advantage. However, vitamin D is the one that will be on your side when keeping illnesses and inflammation to a minimum. So now you know in MS, boosting your immune system isn't always protection like it is for normal people. Sometimes it's provocation. Okay, so fatigue. Fatigue is one of the most misunderstood MS symptoms. And as a nurse, I used to think of fatigue as, well, tiredness. And it's not. In this case, it's definitely neurological. It's heavy, it's limiting, and it's unpredictable. So, kind of a little anecdote for me, there was a time that I took something as simple as an antihistamine that we all know well as Benadryl. And this was especially when I was working nights, wanting to get right to bed for my next shift later that evening. With that, I found there were times that I wasn't just tired, but I was shut down. And if I didn't understand what was happening, well, I would have assumed that my MS was getting worse. Thank goodness it wasn't, but what I was taking certainly didn't help. And with this, I'm talking about sedating antihistamines like Vistaril or Atarax. Those are the brand names, of course. Sleep aids such as Unisom, some anxiety medications like Elavil. They can make your brain fog worse, make the fatigue worse, and possibly even make your mobility and function symptoms worse. Yes, I know. You might be saying, wait, Erin, they give me Benadryl before my infusion. Well, that is one of the safer antihistamines, but I'm a broken record again. Check with your MD before you go popping those pink tablets on the regular. Now, what if some of your worst fatigue days wasn't your MS? If you've ever had a moment like that where something just felt off but you couldn't explain it, I want to hear that from you. Please drop a comment and share your experience. And especially if you value this kind of perspective. Now let's talk about nerve communication. So, from a medical standpoint, MS disrupts signal transmission in the central nervous system. So your brain and body are already working harder to communicate. Now layer on medications that depress the nervous system, slow signal transmission, like muscle relaxers such as Xanaflex that can really lower your blood pressure, baclofen, and yes, I know it's widely prescribed for MS, but can still increase the sensation of weakness. Then there's benzos. These are what I call your nighty-night drugs, such as Valium and Ativan. Yes, you will sleep like a 20-ton boulder, but then you may still feel that way even when you're awake. And certain pain medications, or maybe light opiates, if you will. If your MS pain is rating at a constant of 20 out of 10 pain, then maybe Ultram or MS Contin could be possible. However, concerning benzodiazepines, that's the formal name of them, and those opioids that I just mentioned, please use extreme caution. These are the ones you hear about on the news or on Dateline. They can be highly addictive and dangerous, like stop breathing dangerous. Finally, there's bladder medications like oxybutynin or trospium. They can be a double-edged sword because while they help with overactive and or spastic bladder, sometimes they work too well and dry out your mouth totally and make for some seriously miserable constipation. On paper, these medications can make sense, but in practice, they can also amplify the exact symptoms you're trying to manage. Or another way to think of it, the meds can dim the light of a room that's already dark. In the next category, steroids. Steroids are a great example of where clinical use and lived experience meet. As a nurse, I have seen them work incredibly well during relapses, especially for myself. However, I have also felt and seen what comes after. They can pull you out of something fast, but they're not meant to carry you long term. Overuse of these medications can, lead to weight gain, mood changes, and or what I like to call roid rage. And that might be, for example, standing up in the theater of a musical to flip off the people at the end of the row who showed up late, forcing the rest of us to move down. And high blood sugars and or diabetes. With steroids, just keep in mind, effective doesn't always mean sustainable, especially with steroids. And next, this is the one I wish more people, I wish they talked about it. And I'm talking about over-the-counter medications. Because as a nurse, they feel safe, they're familiar, they're routine, they're insanely accessible. But MS doesn't care if something is over-the-counter. For example, you got your cold meds, NyQuil, maybe some Sudafed. I'm just gonna make this long story short. There's a whole lot of chemicals in there and not all of them may be great to mix with MS. Next, I'll mention laxatives. We MSers have the pleasure of playing Russian roulette with our bowels to begin with. And when you throw in laxatives, then you may as well just plan your day somewhere within the bathroom, eyesight-wise. Also to mention, it can really mess with your electrolyte balance. Then there's NSAIDs. Like the rest of the general population, ibuprofen tends to be hard on your stomach, and if taken too much, can lead to bleeding. Then Tylenol, while better for your stomach, it can be really hard on your liver. So you got to keep in mind, your multiple sclerosis liver isn't like the average person's. It's honestly more sensitive than a bare pinky toe around a bunch of cement blocks. Please just be aware that accessibility for us, and I mean MSers us, doesn't always equal compatibility. Broken Record Erin will also say again with so much emphasis, talk to your doctor about all of these medications, anything I've mentioned here, just to be on the safe side. All right, so, well, what do? Well, you combine knowledge with awareness. You go to your doctor and you ask good questions, things like, how does this affect MS specifically? And what should I monitor? What will be monitored? Track your symptoms. And for that matter, I've got some tools and guides out there, wink wink, in other videos that you are more than welcome to use. Because one thing I've learned as both a nurse and a patient, data, whichever you're from, that matters, but your experience matters just as much. Living with MS changes how you move through the world, really. And being a nurse taught me medicine, but living with MS taught me a lot of self-awareness. So here's one thing I want you to take from this. Not every worsening symptom means your MS is getting worse. Sometimes it's something you can actually change by making good choices and learning as much as you can about multiple sclerosis. If you found this video helpful, please subscribe. Feel free to comment on anything I've discussed, any other videos, questions, comments, concerns, and for that matter, heck, throw a like in there for a just because. I'll be seeing you in the next video.